Hello, I'm Smits for the Capital Network, and joining me from Visioneering Technologies is its President, Executive Director and Chief Executive Officer, Dr. Stephen Snowdy. Stephen, welcome.
Thank you.
Now, Stephen is considered one of the leaders in the vision industry. Stephen, can you start by explaining to us simply what is myopia and why are we experiencing a global epidemic?
Sure. Myopia is simply nearsightedness, and nearsighted means that a person can see something up close, but they have trouble seeing things that are far away. Over the past 30 to 40 years, most industrialized nations have experienced a doubling in a percentage of their children who are nearsighted, which is obviously a major issue. Singapore and China have recently declared nearsightedness in children to be national healthcare epidemics. That's how big of a deal this is. 80 to 90% of children in some Asian nations are nearsighted, which is obviously a major issue. As with anything in medicine, of course, there's a genetic component, environmental component. We can't do much about the genetics. One of the large parts of the environmental component, though, is the amount of time that children spend indoors. Children really need to spend much more time outside to minimize the risks of developing myopia or severe myopia.
So what is currently being done to assist children with myopia?
There's very little actually available to help these children in their myopia. The really important thing about myopia is not addressing the nearsightedness. Of course, it's important to get the children seeing clearly. That's a very important goal. But it's also very important to minimize how fast they progress into worse and worse nearsightedness. And the reason for that is that the worse their nearsightedness is, the more at risk they are throughout their entire lifetimes for blindness and other really serious ocular diseases. So there's very little that we have available these days to slow down that progression of the myopia. There are some drugs, some more experimental types of lenses. Visioneering Technologies, revolutionary optics have been shown to reduce the rate of myopia progression or worsening of nearsightedness in children by up to 90%.
Okay. Now, when it comes to the global eye care industry, in the next 5 to 10 years, where do you believe we're likely to see the greatest amount of innovation, or where is the need going to be coming from for that innovation?
Well, the need is certainly going to be coming mostly from the industrialized nations. In the United States, 30 to 50% of our children are nearsighted, 90% of children in some Asian nations. So that's obviously where the pockets of needs are. What I see happening in the next 5-10 years is a recognition that optics, when well designed, can help control myopia and its progression.
Well, Stephen, thank you for your insights today, and we'll certainly be watching in the future.
Well, thank you.